welcome to another episode of TrialSite News. Today we're going to be focusing in on the quest for universal vaccines as a 2.0 COVID-19 solution. But considering the growing frustration around the world about vaccine mandates and lockdowns, it almost assuredly would follow that the deepening trust gap for those in charge of world governments will only accelerate, fueling ever more political polarization around the world. And so we're going to discuss what is going on here. From TrialSite News, I am Adrian, and our episode is starting right now. So the first wave of what we here at TrialSite News are referring to as version 1.0 COVID-19 vaccines were part of a public health communication scheme that was as much political and economic in nature as it was health and science related. From the start, a confluence of national, public health and research agencies, regulators, and industry discussed eradicating the SARS-CoV-2 pathogen. This despite the fact that it was a volatile, dynamic, and mutation-prone RNA virus. There seemed to be a uniform scripted agenda to line up populations from all the countries around the world for a mass vaccination program, which is unprecedented in modern times. There was talk of hitting 70% vaccination rates to achieve herd immunity, and implicit in the scheme was an assumption that the vaccines would all but stop viral transmission. But as we've seen, this has so far proved fruitless, as the type of virus that SARS-CoV-2 represents, not to mention those novel vaccines developed in just a matter of months, most certainly have vulnerabilities. Now, nothing is ever perfect, and particularly not in the middle of a pandemic. Consequently, all the talk of herd immunity and normalcy went out the window by the summer of 2021 when it became apparent that the Delta variant was associated with breakthrough infections and even some high-profile breakthrough hospitalization scenarios in Israel. It has become apparent that COVID-19 is far more difficult than governments and health authorities chose to believe, especially early on. The pathogen continues to mutate while vaccine experts try to suppress the virus. And along the way, critics and alternative voices were also suppressed. The vaccines have contributed to bursts of protection, where hospitalization and death rates were lowered, but unfortunately, any celebratory efforts by those in charge were short-lived. And now the highly infectious mutation known as Omicron has punctured the vaccine shield. Waning immunity is taking its toll. And according to a recent study by some California physicians, the elderly, vaccinated or not, are facing imminent danger. In their still-to-be peer-reviewed study, they found that the fully vaccinated elderly in the UK were dying at an accelerated rate. Now, we here at TrialSite News have observed similar trends in other heavily vaccinated places, like in the country of Australia. Even the World Health Organization has got around to addressing this growing problem by saying the following. They said that current COVID-19 vaccines, which are based on the ancestral strain of the SARS-CoV-2 virus, continue to exhibit strong protection against severe disease and death across all virus variants seen to date. Achieving high coverage rates with the primary series and first booster doses in the highest and high priority use groups in every country remains the priority. However, the emergence of variants of concerns has resulted in a rapid decline of the protection against symptomatic illness. There is therefore a need to assess whether variant-updated COVID-19 vaccines, especially to Omicron, would improve vaccine performance. And so here we are. Pfizer and Moderna have made billions of dollars with the first round of COVID vaccines, and naturally many citizens of countries around the globe assumed that the pandemic would move towards a much reduced emergency state. After all, the governments promised that this would be the case. But it's not. So now there's talk of a universal vaccine. You see, with over 9 billion doses of COVID-19 vaccine administered worldwide over the past 17 months, and about 50% of the world's population classified as fully vaccinated, along comes the mutation called Omicron and its subvariants. And of course, breakthrough infections, hospitalizations, and deaths are now becoming the norm, which is raising the specter of the need for billions more dollars invested in the next generation of COVID-19 vaccine. Companies such as Pfizer and Moderna are now not just promoting an expansion of the current vaccines to target specific variants such as Omicron or the subvariant BA4 and BA5, but they're also promoting a brand new, quote, universal vaccine that, according to their promotional materials, could target all viruses. The medical establishment is optimistic here. They say that thanks to radical breakthroughs in technology, process, and an alignment of commitment and lots of public or taxpayer dollars, they can achieve powerful version 2.0 vaccines, and they think it'll become a reality in the coming years. All sorts of investments are announced for the next generation vaccine in this new ongoing healthcare crisis. Similar to the Cold War or the War on Terror, now we have the viral mutant wars that may terrorize populations for decades to come. An example of this was a $36.3 million injected into a few academic medical centers, leading research and development into universal vaccines. This is driven by the National Institute of Allergy and Infectious Diseases, otherwise known as the NIAID. You have 3 universities, Duke University, Brigham and Women's Hospital, and the University of Wisconsin involved, and they are pursuing the ultimate pandemic buster. Now, unsurprisingly, Dr. Anthony Fauci, who happens to be the director of the NIAID, had something to say about the deal, declaring that, quote, "We want a pan-coronavirus vaccine so that you can have it on the shelf to respond to the next viral pandemic." Now, this, of course, begs the question, as our own founder of TrialSite News, Daniel O'Connor, asked, isn't this what the existing vaccines were supposed to do? They were supposed to overwhelmingly address the current virus. In any case, Walter Reed Army Institute of Research has a team of investigators working on a novel super vaccines, or at least that's the hope. One targeted universal vaccine known as the SARS-CoV-2 spike ferritin nanoparticle, or SPFN, vaccine is now in phase 1 in clinical development, which is the safety and dosing phase. Meanwhile, CEPI placed $42 million into a University of Cambridge spin-off to develop super vaccines. Earlier this year, CEPI announced a $200 million program to develop broad-based beta coronavirus products in the hopes of preventing future coronaviruses. Additionally, a month earlier, CEPI announced it secured $214 million from the UK government to cut the development time of a vaccine down to just 100 days. Imagine that, vaccines on demand. But there is just one problem with this urge for hyperspeed. Corners are oftentimes cut when you're in a hurry. So let's take a moment to step back and look at the situation here. While the first wave of COVID-19 vaccines helped reduce hospitalization and death, at least in bursts, they have failed miserably to stop viral spread. Yet, due to the politicization of the pandemic, the status quo has been to drive a universal talking point. The original vaccines were talked about as near perfect. So much so that even here in the US, the land of the free, our president sought to enforce draconian mass vaccine mandates across American society. You had school districts such as LA Unified. You had various agencies, companies, and universities enforce mandates of a vaccine that still hasn't stopped viral transmission, especially now with the predominant circulating Omicron variants and subvariants. Now let's be honest about the mandates. Unsurprisingly, huge numbers of working-class people opted not to receive the vaccine, and they were terminated from their jobs. They were fired. This led to shortages in the labor market, and has created an unprecedented mistrust in government and a dangerously widening political and cultural polarization in our country and around the world. The pursuit of scientific knowledge involves the definition of social and hopefully common purpose. You have a construction of a hypothesis. You have testing of such hypothesis, collection and analysis of data, and of course, formulation of conclusions, as well as an ongoing critical review of assumptions. It is time for health establishments, which include apex regulatory and research bodies, national public health agencies, medical societies, and boards and leaders in academic medicine and health systems, to start scrutinizing their own hypotheses, their assumptions, and models, to admit where the current material failings now exist, the ones not only holding society back, but contributing to a dangerous lack of trust in government. After all, wasn't the original goal at the outset of this whole pandemic to have the solution be driven by science? Those in power would be wise to take heed and note of the frustrations and mistrust by many in the public. Time will tell, of course, if that happens. And that, my friends, will bring our episode to a close once more. As always, thank you so much for joining me on the program today. From TrialSite News, I am Adrian, and I will see you all next time.